Wonderful. Hello, welcome. We're thrilled to have you here today. I see people coming in. We'll just give it a second as everyone pops in to join us. This is the launch of the Docs with Disability ACGME Disability Resource Hub, something that's been in the works for quite some time. We're excited to share with you. I am Morgan Passment with the Accreditation Council for Graduate Medical Education, often shortened to ACGME. If you're here, you're probably familiar with us. And I've had the pleasure over the last several years of working with this team from Docs with Disabilities Initiative through a Josiah Macy Jr. Foundation grant to create a set of resources to support our learners, our institutions, and our programs to help individuals with disabilities as they transition from undergraduate medical education into graduate medical education. If you've ever been in this space, you know that sometimes you feel that you want to do something, but you don't know where to turn, what resources are available to you. And it's been a pleasure to work with the team to put these resources together. Today, what we're going to do is walk through and describe what the initiative is, its intent. We're going to navigate through the different resources. And then we're going to discuss a little bit about how you can integrate this into your own environment. First, I want to introduce our speakers. Today, we have with us Nalinda Charsangave, my apologies. Zoe Sheets and Lisa Meeks is with us, but off camera today. She is a little under the weather, but still here to support us. And Justin Bullock, who is not able to be with us, but also a big player in putting all of this together. And with that, I am going to move on to our next slide so that you can see everyone and what their role is. And then Nalinda is going to walk us through some of the background. Nalinda?
Great. Thanks so much, Morgan. Before we talk through the hub itself, I'm planning on briefly providing some background as to why this resource is needed. Zoe will also help in this portion. But in the next few slides, we're going to give you a snapshot of what we know from national data about disability prevalence, disclosure, and access across UME and GME. These data points will help us explain the persistent gaps between policy, practice, and learner experience. Next slide, please. So in undergraduate medical education, we've seen a steady increase in students self-reporting disability over time. Across multiple national studies, prevalence has risen from roughly 3% to over 11% in recent years. This reflects who is entering medicine and who is disclosing. While the number of learners is increasing, only half of these students go on to disclose to their programs in residency and formally request accommodations. So while disabled learners are clearly already here, many are navigating training without institutional support. In our next slide, when we look at graduate medical education, while there has been an increase in self-reported prevalence each year of disability, the numbers drop a bit when we compare UME to GME. Almost all of this decline is in psychological disabilities or in the category of psychological disabilities. And we hypothesize that the decrease is due to increased barriers during residency training, including concerns about stigma, uncertainty about policies, and fear of professional consequences. And we will probably likely be talking about this much more as we go through the course of this session. So among residents who do report disability, the most common categories are by far included ADHD, chronic health conditions, psychological disabilities, and learning disabilities. Physical and sensory disabilities are far less frequently reported in GME, which may indicate heightened barriers to disclosure and access in clinical training environments for these populations. Importantly, the ACGME maintains specific requirements around disability. For example, the ACGME Core Program Requirement 1.8E listed here states that programs in partnership with their sponsoring institution are required to ensure healthy and safe learning environments, which includes providing accommodations for residents with disabilities. In addition, the ACGME also has a complementary institutional requirement, 4.9D, that requires sponsoring institutions to have a disability accommodations policy consistent with applicable laws. Notably, this policy does not need to be GME specific, but it does need to exist, be accessible, and be usable in practice. And as we'll see later, policy alone is not enough if implementation guidance is missing. I'm now going to pass it on to Zoe.
Thank you, Nalinda, and thank you so much, everyone, for being here today. I'm going to dive a little bit deeper into some of the literature that has really reminded us why a resource such as the Hub is so important. And starting with that policy component that Nalinda had just mentioned, a 2020 study found that only 68% of institutions were compliant with having a disability policy. This is a piece of work that learners look for when they are applying to a program that helps guide their understanding of how they can access what they need, and also helps the members of the institution who are supporting the resident know what the expectations are and what can be done to connect them to necessary resources. Next slide. Additionally, we think about messages of welcome as something that learners look for to understand where they may find support. Diversity statements and non-discrimination statements often fail to include disability, or if they do include disability, it's being included less than any other identity. There's a few studies that have captured this, including one in pediatrics, ophthalmology, and radiology, respectively finding that only 27, 53, and 25% of programs mentioned disability in their diversity or non-discrimination statements. Next slide. Melinda mentioned this earlier, but the impact of stigma and uncertainty is incredibly important for learners. Less than half of interns in need of accommodations requested them in this study by Dr. Pereira Lima, with the three most common reasons for not requesting them, including fear of stigma or bias, with nearly 60% of interns reporting this as the primary reason, a lack of a clear policy, as noted on the last slide, and then lack of documentation, not having what they need to be able to demonstrate their disability and access the resources that they're seeking. The importance of program access. Program access is defined as having needed accommodations or not needing accommodations, essentially having access to what you need in your program. For residents, lack of program access, not having those resources, is associated with increased depressive symptoms and self-reported medical errors. But very importantly, residents who had program access did not see this increase. This was specifically residents with disabilities who are lacking program access. For medical students, it's been shown that those who do not have program access have increased burnout, specifically the burnout marker of disengagement, and also a worse perception of their learning environment, feeling less supported in their professional and personal development and in student to faculty and student to student interactions. And then leadership perceptions. In this incredible study that interviewed internal medicine program directors and helped understand what is their perception of supporting learners with disabilities? How do they feel about accommodations? Generally, disability was viewed as intrinsic deficit. A quote from the study said, "Disability is like a component of your person that is a hindrance to achieving." It was often contrasted with normal or standard ways of being. The study also found that program directors had limited understandings of accommodations. For example, what does that look like in the employment context? How do we navigate that with someone who is simultaneously a learner and an employee of the institution? And what is the scope of legal protections? Many program directors felt that there was insufficient guidance on disability inclusion. They were looking for those practical tools, those examples of who has done this before, how was it done, and what were the outcomes. A specific quote said, "What would be helpful is a menu of accommodations along with a contact of other program directors who have implemented this." And so, with all of that being said, we are so pleased to introduce you to the Disability Resource Hub. This hub was developed as a collaboration between the ACGME and the Docs with Disabilities Initiative under a Josiah Macy Jr. Catalyst Award to address all of the gaps that we've been discussing in this brief literature review, particularly the need for practical implementation ready tools for programs and institutions. The hub is really organized around usability, and it brings together case studies, those examples we were talking about, toolkits, policy guidance, curated resources, all in one centralized location. The goal is to help reduce that uncertainty, to support consistent decision making, and to give programs concrete examples they can adapt rather than having to start from scratch. Here you can see what the hub looks like in practice. Everything is designed to be easy to navigate and immediately useful. Whether you're a program director, coordinator, disability professional, learner, or institutional leader, if you're looking for guidance to support learners with disabilities, you'll find it here. One of the most requested resources from program directors has been real-world examples. I'm really excited to highlight the case studies that are included so far and note that these will continue to be developed as well. These move us from theoretical ideas and best practices to implementation of policy into practice. Morgan, I'll turn it briefly over to you.
Just
The
Melinda,
next slide. Oh, yeah, sorry. The next slide, I think will provide information about CME for case studies. And then one more slide.
One more. Okay. Sorry, Zoe, I wasn't keeping up with you. Okay.
No worries.
So just really quick, wanted to mention that the ACGME, as part of our role in contributing to the hub, is offering continuing medical education credits for the case studies, which was an opportunity to allow you to gain some credit while you're going through this very important topic, and you'll learn so much. There's a green bar at the top of the case studies. You click on that, that will take you into our Learn system. It's a free account. You log into that and you can receive your credits that way. Back to you, Melinda. All right.
Yes, next slide. Okay, so as mentioned before, program directors often seek guidance from others who have gone through the experience of implementing accommodations in GME. I myself, as a program director, this really resonates with me. And this portion of the hub includes published case studies co-authored by program directors and disabled learners who have successfully partnered in implementing disability accommodations. The published case studies highlight practical solutions and span various different specialties, aiming to challenge harmful misconceptions while empowering learners and educators to strengthen accessibility in GME. Next slide. So one of the first case studies to be released was authored by myself and a former resident with a physical disability. As part of this paper, we included some resources, including an outline of the potential different entities with whom a program director and learner may engage throughout the process of implementing accommodations. There are additionally further resources, including outlining what the role of an access assistant is, and that was one of the unique accommodations in this case. Next slide. The next case study was authored by a nephrology research fellow and his program director. I think it really highlights the importance of building a trusting relationship between a program director and their learners. I will also share that each case study is accompanied by a podcast episode, as well as a presentation or discussion with the co-authors. And so each of the published case studies has these complementary resources as well. As you can tell, each case study represents a different category of disability in a different specialty. This particular case study is about a urology resident and is presented alongside his competency development coach and residency program leadership. It highlights the importance of early identification and disclosure of cognitive disabilities to implement accommodations that are tailored to the individual learner. And it also aims to shift conversations from a stigma-laden remediation process focused on deficits to a process that fosters growth. And then the next case is authored by a psychiatry fellow and her program director, and focuses on navigating accommodations processes for ADHD and a reading disorder, and the significant challenges that were faced in fellowship training despite earlier successes in UME and GME. It also highlights the importance of formal protocols and policies within institutions. And as you can see, these are just some of the completed cases that are a part of this series, with others forthcoming and to be released on an ongoing basis as all of the elements are completed. So this hub is definitely what I would say sort of a living document. And as more things are published, and you will see new things being released on an ongoing basis. I will pass things off to Zoe now to talk about the UME to GME transition toolkit.
Thank you so much. I am so excited to share about this toolkit, one, because I had so much fun developing it with Nalinda and our committee, but also as a resident with a disability who recently transitioned, I see the deep value in a toolkit like this, both to support program leadership who may not have done this before, may not be certain how to do it, but is invested in doing it well, and also for someone like me who is looking for guidance from a learner perspective. Next slide. With that, I do just want to say that the transition toolkit is really intended to capture the role of so many stakeholders. As is true for the hub overall, it's intended to be used by UME leaders, GME leaders, and learners to understand how to support this growing population even more. We had this graphic created to capture the fact that accessibility is really created when all three of those stakeholders are collaborating and working together. Next slide. I will say this toolkit is rather large, and so I do want to highlight before I jump into the sort of overview of the transitions toolkit that the toolkit and the hub overall is equipped with a search function to allow you to look for particular things if you have a specific question. This toolkit contains two guides. One was created for institutions and learners, or institutions and programs, pardon me, and one for learners. You'll notice that they mirror each other very closely, and truthfully, a lot of the content is the same as well, but with a shift in language and a focus on the guidance for which particular audience it's facing. The learner guide was created by the learner members of our committee first, so that it was a learner to learner, a near peer mentorship perspective, and then reviewed by the rest of the committee to make sure that the perspectives of the program directors and other institutional leaders weighed in as well. You can see if you look at both sides that the toolkit guides start in undergraduate medical education. They move into recruitment season and the match process for GME, and then they move to during residency as well. Within the recruitment season and match process, it's broken down into pre-interview communications and recruitment, sending interview invitations and doing the interview process, and the post-match transition, because that match period is such a hefty part of the transition itself. Under each of these, there are specific forms of guidance, everything from career guidance to thinking about accommodations, different forms of communication, career advising, and how to make sure that faculty and staff are up to date on everything they need to know for supporting people with disabilities. Next slide. We wanted to give a few examples from the toolkit. The toolkit is set up for each one of those items that were featured on the last slide to have three key components. The first is a description of what we would recommend. So on this slide, you'll see invitation emails and pre-interview communications with a brief paragraph of our recommendations, what we suggest you do to create accessibility around this component. Each item also has guiding questions to consider, which are reflective questions for program leadership or whomever is using this guidance to think about, okay, if this is the recommendation, how do I actually implement that into my context, knowing that every program is different? Next slide. And then each also has resources. These resources vary depending on what the item is and what we felt would be most helpful. But resources include current literature, webinars and podcast episodes. It also includes things that we crafted ourselves. Next slide. For example, if we've asked you to send an invitation email that includes particular information, we drafted an example for you so that you could see what does this look like in practice and pull this, put in your own information and use it. That way it's focused on ease of use and accessibility. Next slide. I did want to highlight a paper that recently came out that Nalinda and I both worked on, but the authorship team that worked on this also conducted a webinar on the transition that really inspired so much of the toolkit. This paper has 4 of the key components that are relevant to the transition and discusses those in detail, but also kind of gives you an overview of why thinking about the transition and the barriers to transition is so important. Next slide. With all of that being said, I do just want to highlight before I move to the next section that each of these sections of the hub will have its own launch as well. And so I told you how incredibly large that toolkit is. The policy toolkit is also chock full of incredible information. And so I think it's worth highlighting that today is a bit of a whirlwind overview so that you're familiar with what you can find in the hub and why it's such an important resource, but there will be more detail forthcoming in each of those launches. So with that being said, this brings us to the policy toolkit, which focuses on creating policy and building standard operating procedures that support residents with disabilities. This is an incredibly frequent request that we receive to offer this type of support. And so this resource is very important for this community. Next slide. The policy toolkit includes multiple elements designed to guide programs through the development of a comprehensive disability policy, and it's organized into 4 core areas. It first guides institutions in developing disability policy with intention. So clarifying purpose, engaging disabled individuals, identifying key stakeholders. It then focuses on application in GME, providing concrete guidance for disclosure, accommodation requests, grievances, communication, privacy, and having a clear point of contact. A third section addresses dissemination, emphasizing centralized access and integration of policy across recruitment, orientation, and well-being efforts. And then the final section really focuses on disability data collection. It offers guidance on monitoring requests, gathering feedback, and supporting accountability, while also importantly protecting privacy. All of these elements together move disability policy from a static compliance document to a functional system that supports transparency, trust, and consistent access in GME. Next slide. The policy toolkit is evidence-based and informed by legal requirements, and we've been lucky to publish a short piece in the Journal of Graduate Medical Education that includes exemplar institutions that are actively doing this work. These examples really show how policy, when it is paired with these clear processes, can support both compliance and culture change. And then with that, I will next slide and turn it over to Nalinda to talk about the last component of the Resource Hub.
So the final section of the hub includes a collection of existing content and resources that fall outside of these newly developed content areas that were just presented. We aim to continue to add to this library of resources as new information is published or becomes available. Next slide. So many of these additional resources include podcast episodes, relevant literature and publications, additional case studies, modules, recorded presentations, and many more resources. Next slide. So as Zoe mentioned, we also want to highlight several upcoming opportunities and resources designed to support disability inclusion across graduate medical education. First, we have two upcoming webinars. The first one, Developing a Disability Policy, the Toolkit, is taking place on February 25th at 4 p.m. Eastern. And this will focus on how programs and institutions can build clear, compliant, and workable disability policies utilizing the policy toolkit. Following that, the Effective Transitions, the UME to GME toolkit, on March 31st at 4 p.m. Eastern, will address the critical transition from medical school into residency, offering practical guidance to support continuity, reduce barriers, and improve access for disabled learners across training environments. Two additional webinars are coming soon. Learning from case studies, disability inclusion in GME, will highlight real-world examples of successful accommodation implementation, focusing on practical lessons programs can apply in their own settings. And then disability inclusion in GME, what the research says, will synthesize the growing evidence base and translate key findings into actionable insights for program and institutional leaders. Together, these webinars and resources reflect a commitment to pairing policy, practice, lived experience, and evidence. So programs aren't just meeting requirements, but building systems that truly support access and inclusion. And with that, I will pass it off to Morgan.
Terrific. So as you can see, there's lots of information. You can scan the QR code and go to the site. As both Melinda and Zoe mentioned, we'll continue to build these out and bring different voices that contributed to this hub so you can hear some of their perspective in future webinars. I did want to take a couple minutes because I saw a few questions in the Q&A to see if we had any thoughts about the questions. I saw the links that people were requesting. Thank you so much. Those were being posted. The first one was about the menu of accommodations concept doable, especially if we can start accommodations listed. Ask Jan. However, it's arguable that this would defeat the purpose of designing accommodations to be flexible and personalized. I'd like to hear back from the panel about the pros and cons of resources like that. Who is empowered by them and who is not, for example. Any thoughts about that as you incorporated that into your work?
I can start with that. We certainly were aware of the Ask Jan resource and included it within the transition toolkit as a resource, with the caveat that accommodations do need to be flexible, personalized, and the process needs to be iterative and addressed on an ongoing basis. What I think is useful about it is I think it serves as a starting point for people to get some ideas about potential accommodations to consider. Although it's really important to note that program directors and residents aren't necessarily the ones that define what the accommodations are. And so it's important to know that these are some ideas, but you would be working with disability resource professionals, as well as other parties in this. But these certainly serve as a resource, and I think, again, a source of ideas.
I would absolutely echo that. I think that having guidance and, ideas of what accommodations look like is actually a really important starting point, because so much of what I hear from both residents and folks looking to support residents is, I don't really know where to start. Like, what is a possibility? If someone has, for example, limited mobility, how can I support their participation in rounds? What can what has been done before, which is part of, what the case studies is intended to demonstrate. But beyond that, I think that having that starting point can be important. Um, I think that you're exactly right, though, that it is a starting point because every disability is different and every person with a disability is going to have different access needs, even if they have the exact same diagnosis or impairment as someone who has come before them. And so much of this work, right, is about communicating what, one, the legal requirements are, and that everyone who needs reasonable accommodations should have access to it. But in addition, what is the benefit of doing this, right? Why does it matter to include these learners? What does it look like to communicate efficiently, effectively with these learners to ensure that it is person-centered and an approach that is iterative and supportive for that specific learner, rather than only responding to sort of a check box of this is what can be done for this disability. I will also say, Morgan, if you don't mind, that's a really good segue into the next question in the question chat, which is around the incorporation of the social model of disability. The participant asks if there's any discussion on the hub of how not all impairments and subsequent accommodations are the same, even if it is the same category of disability. This is so incredibly important and something I think about often. As a disabled researcher, a disabled physician, and someone who cares about patients with disabilities as well, is that incorporating that social model of disability is going to be really important, right? Because the experience of disability is so much more than simply the manifestations in the body, right? It's also a social experience. It is an experience that will impact someone's professional identity. It is, for me, socio-political identity just as much as it is a diagnosis, if not more. And so we worked really hard to capture throughout the hub, that supporting people with disabilities as people and including that important identity as a part of your interactions. I think that one way we did that in the transition toolkit, I'll just speak to that since that's the part that Linda and I worked on, is really talking about what do you do if someone tells you they have a disability, right? We have a full one pager on how do you respond to disability disclosure that is trying to zoom out of that sort of lens of, okay, someone disclosed, now I need to figure out accommodations and what's the logistical next step, et cetera, and really zooming out and recognizing this as a moment of connection and a moment to better understand that learner, and how this piece of their identity will not only inform what they need to thrive in residency, but also all the gifts they can bring to their patients in the program.
Perfect. I see a few more questions here. One is asking about cases related to the need not to work overnight, which I don't think we have any of, but could you speak more deeply about that?
So that is certainly an accommodation that is commented upon or addressed in the transition toolkit. I can think of one of the resources specifically focused on approaches to scheduling. So there isn't a specific case study to my knowledge, but there are certainly aspects of that as an accommodation addressed throughout the transition toolkit.
I'll just chime in really quickly and say that Dr. Volek, who is the physician featured in the case study about a physician with bipolar disorder, that was a really important accommodation that he utilized throughout residency. And in his podcast episode, it is featured really heavily. So I would point you to that resource if you want to hear more about how it was implemented for that specific learner.
I would
Perfect.
also
Thank
say
you.
in the following question about intersectionality, um, Dr. Green in her case study also specifically mentions the importance of her different identities that are also incorporated into that case study.
Perfect. And I did want to thank Lisa in the background. I see you responding to some of the data comments in the chat there. Thank you for that. If people were looking for the article there that she shared. And we have a question, looks like from a resident, currently in the process of seeking disability accommodations. As a resident, my program's never had to make disability accommodations, it seems, and GME HR is limited in their thinking regarding accommodations. I keep hitting a wall. Would love to hear any recommendations you have on next steps.
I would certainly start by sharing the hub as a resource, particularly with a focus on the policy and transition toolkits.
Perfect.
Yeah, I wanted to start by saying I hear you because I was in the exact same boat when I started residency, and that's part of how my scholarship shifted to specifically be focused on UME to GME transition, because I find that it's a really just critical time in our careers. And so I hear you, and I know that it's hard. I would say Melinda's point is actually really critical, right? Because historically, what has happened is learners have had to sort of scramble to either find folks who can give them guidance or who have done it before, or pull the literature themselves and try to sort of collate it and share it with folks. And this hub was developed specifically for this moment. I had the opportunity recently to share it with my program director and the lead of GME at my program. And the way that it was able to spark a conversation in a way that I think helped them feel empowered, but also just took so much burden off of me. The things that I didn't necessarily have the time or energy to explain in detail was right there. That's why we made it, is so that people have something to share without having to always sort of have the burden on them for teaching. So I would encourage you to do that. And then I'll also just say, it can be really exhausting to navigate this. So I hope you find community to support you. The podcast, beyond the case study podcast episodes, although certainly those as well, is a really good place to turn to sort of hear stories who have been there before, for some asynchronous mentorship and just feeling a little bit less alone in the process as well. I wish you good luck with all of your accommodations.
I think the following question after that is a variation on that of understanding legal requirements and getting help. I would say from the ACGME perspective, we very much depend on the organization, the sponsoring institution, and what are their policies local. So knowing what those are. And then there may be additional GME related policies, but specifically it is anchored in what is the sponsoring institution's policies around that. So knowing what those are and reaching out to HR and talking to the community about that is a good place to understand when you say legal requirements. I know Linda or Zoe, if you had any other resources you'd recommend.
I think in addition, and again, I echo sort of what Zoe said about the prior comment, that this is incredibly difficult to navigate as an individual, but part of the reason why these resources were developed, as well as in particular the transition toolkit focused on written by learners, is meant to be able to provide you access to answers to some of these questions. I think it is obviously a lot to take in and digest all at once, but certainly finding your way to that toolkit and beginning to look at some of the resources depending on sort of where in that period of transition you are is a good start. And then obviously sharing it again with your program. But there's a reason why we specifically developed the learner toolkit to help empower learners to find ways to provide this information to their programs if they aren't using the toolkits themselves.
Thank you. I see in one of the questions there's a ask about, very excited about the new resource. I'm a developmental behavioral pediatrician and fellowship director at the University of Washington. Thanks for being here. I am wondering if the ACGME has considered ECHO training opportunities in this area to support program directors and administrators across the country. I think that's some of what we're doing by the follow-up webinars, but I will turn to the team to see if there have been any discussions about that.
I am not personally aware of ECHO training opportunities. However, one of our goals is to assess the implementation or to disseminate the information that we have. And so I think we'd be open to opportunities to have additional training sessions, perhaps in various venues. So be on the lookout.
Agreed.
Fantastic. A really interesting question. Given the need for guidance for residents, any literature on how accommodations are provided to practicing physicians, if any?
I am not specifically aware, but Zoe maybe.
Yeah, I mean, the body of literature on physicians with disabilities similarly continues to grow. And I will say it unfortunately echoes some of the things that we talked about today. Things around mistreatment, limited pay. I have a paper that I'm working on right now around the rate of attrition for physicians with disabilities. So I welcome Dr. Meeks to share any specific papers on how accommodations are provided for practicing physicians. I don't know of any off the top of my head, but we do know, really importantly, that the number of people with disabilities declines across the training to practice pathway, with most recent data showing about 17% of medical students identify as having disabilities, about 10% of residents, and about the most recent data I'm aware of. I invite Lisa to correct me if there's new data, but only 3.1% of practicing physicians. So that's a steep decline over time. I will say the medical student data is a bit more updated than practicing physicians. But even when that wasn't the case, there was a steep decline. And it's very much worth investigating why that's happening and what is driving that. I think that a lot of the things we talked about today are likely part of it, things around stigma, mistreatment, et cetera. But not having accommodations at work would be a really critical part of understanding attrition as well. And that's something that the paper that I'm working on looks at as well, is how accommodations impact that rate of attrition. So echo that it is an important question to continue asking and for the literature to continue investigating.
Want to add anything to that, Melinda?
I think I can only speak to the very limited experience I've had, but in sort of in my limited observation, I've had actually some success in practicing physicians continue to receive accommodations they received in residency with maybe perhaps a little less effort in order to obtain them. So that at least, and again, my limited personal experiences was a positive.
And what I'm hearing from both of you is this opportunity as we look at the learning pathways and how do we create environments that are inclusive for a diverse group of individuals. how does that carry into practice, and what are the opportunities there as we build these and not build them in isolation, to think about that as part of the organizational structure. We have another question. Thank you for your incredible work, which I applaud you as well. It's been phenomenal and I appreciate it. I'm concerned about limitations and resources for smaller programs and programs without large academic institutions to support their work. Oftentimes, PDs are not well supported and boundaries and limitations must exist. Your resources or articles about when disabilities can and should be denied in order to manage resources for the entire community? And I think this comes up a lot about how do we provide resources for one and how does that impact others? What are your thoughts on that?
I think that my approach would be to think about ways that we manage resources that provide benefit to the entire community of trainees. So, accommodations related to, for example, protected time to attend appointments. That is something that, as a program-wide culture, we've instituted for all of our trainees. So I think flipping that about thinking about how resources can be and changes can be made to benefit all learners.
Echoing that, of course, I would also just add that data has shown that the large majority of accommodations don't cost any money, and those that do cost money are still rather affordable. And so I think that there is sometimes a quick reaction to worry about what the cost will be, both financially and in terms of, concern for added workload on other residents and things like that. But echoing what Nalinda said, I think that often if there is something that one learner needs, there are other learners who have needed it as well and maybe didn't feel comfortable expressing it. And so thinking about accessibility and universal design as a goal for the program can be important. I do very much hear the concern that not every program director has the support that they need. And, at risk of sounding like a broken record, that's why we made the hub, right? Is to make sure that people understand what the requirements are, first of all, so they know what's non-negotiable, which does include providing reasonable accommodations for anyone who can otherwise reach the goals of the program. Thank you so much, Lisa. Most accommodations are less than $500, with 96% being a zero cost. A little bit more specificity on what I was saying earlier. But making sure that program directors know what their requirements are, but also so they do have some support in thinking about, in my program with its limitations, with whatever support I'm getting, how can I get creative and try to move forward with access and accommodation for anyone who may need it.
Perfect. And I see we also got a little more information on the Project ECHO, which is the extension to community healthcare outcomes. For those that were not familiar with it, it's an opportunity to put small groups together to actually develop practices and then disseminate those through that sort of ripple effect of sharing, or hence the ECHO name. Also, some interest in being able to follow up with our speakers if they're willing. Certainly, I think they'd be happy to share with you some of their experiences and direct you to the resources that we've identified. I see Lisa. I just want to thank you, Lisa, because I know your voice is not with us today, but you're here in spirit. You've put some wonderful information in the chat, and we'll try to make sure that also gets shared going forward, some of the materials and articles that she shared, so that people have that information as well. Any final comments that Nalinda or Zoe you would like to share?
I would just share again how incredibly grateful I am to the team that I created this hub with, Dr. Meeks and Dr. Transangave, Dr. Bullock, our committee, Morgan, for your incredible partnership and the partnership of the ACGME. Absolutely a pleasure to work with all of you. And then, of course, the Macy Foundation for all of their financial support as well, and investment in making sure that medicine continues to be more and more accessible for learners like myself.
I couldn't say it any better. But really appreciative of this fantastic team. Grateful to see such interest and engagement in our work. And we hope that you all utilize these resources, provide us with feedback on how you and share stories of how you've implemented and utilized the resources. And hope you tune in to our forthcoming webinars about each of the individual aspects of the hub.
Thank you, everyone, for joining us today, and we look forward to sharing with you again in future webinars.